What is dementia in older adults? Let's talk about dementia in older adults. So, what exactly is it? Dementia is a condition that affects your brain, making it harder to think, remember, and carry out everyday tasks. It's not a specific disease, but rather a group of symptoms caused by damage to the brain. This damage messes with how your brain works, and over time it can really take a toll on your mental and physical health. Now, a lot of people think dementia is just a normal part of getting older, but that's not true. Sure, it's more common as we age, but it's usually caused by specific conditions, like Alzheimer's or other health problems, not just aging itself. What does dementia look like? Dementia often starts small. Maybe you forget where you put your keys or can't recall a name. These things happen to everyone, right? But with dementia, it goes beyond that. Over time, it gets harder to solve problems, make decisions, or even handle everyday activities like cooking or managing money. For some, there are also emotional changes, things like anxiety, depression, or even mood swings. Catching dementia early is super important. When you recognize the signs, you can start getting help sooner. This might mean seeing a doctor, adjusting your lifestyle, or getting support from family and caregivers. It won't cure dementia, but it can slow things down and improve your quality of life. In simple terms, dementia is a condition that affects how your brain works. It's more than just getting older and forgetting things. It's about bigger changes in how you think and live. The good news, with early detection and proper care, you can make a big difference in how it's managed. What causes dementia in older adults? All right, let's break down what causes dementia in older adults. First off, dementia happens when there's damage to the brain or the connections between brain cells. This damage stops the brain from working properly, making it harder to think, remember, and live life as you normally would. But here's the thing. Not all dementia is the same. There are actually two main types, neurodegenerative and non-neurodegenerative, and each has its own causes. Neurodegenerative dementia. This is the type that progresses over time, and unfortunately it's irreversible. Here are some common causes. 1. Alzheimer's disease. This is the big one. Around 60 to 70% of dementia cases are actually caused by Alzheimer's. It happens when clumps of protein build up in the brain and damage healthy brain cells. Think of it like a roadblock in your brain's highway, stopping things from working smoothly. 2. Vascular dementia. This one's all about blood flow. If the brain isn't getting enough blood due to damaged blood vessels or strokes, it can lead to dementia. 3. Lewy body dementia. Weird clumps of protein called Lewy bodies can form in the brain, leading to memory and movement problems. 4. Frontotemporal dementia. This affects the front and sides of the brain. It's less about memory and more about personal changes and trouble with language. 5. Mixed dementia. Sometimes you can have a mix of these types, like Alzheimer's and vascular dementia, happening at the same time. 6. Other causes, things like Parkinson's disease, Huntington's disease, or even repeated head injuries, like in athletes, can also cause dementia. Non-neurodegenerative dementia. Now, this type of dementia isn't about brain cell deterioration. It's caused by other issues, and some of it can be reversible. Let's look at a few examples. 1. Infections and immune disorders. Infections or conditions where the immune system attacks the brain can cause dementia-like symptoms. 2. Hormonal or nutritional problems. Low levels of vitamins like B12 or issues with the thyroid can mess with how your brain works. 3. Toxic substances. Things like heavy metals, pesticides, or even too much alcohol can damage the brain. 4. Brain tumors or injuries. Tumors can press on brain tissue, and head injuries can cause long-term cognitive problems. 5. Oxygen deficiency. If the brain isn't getting enough oxygen due to sleep apnea, heart problems, or even carbon monoxide poisoning, it can mimic dementia symptoms. Dementia isn't just one thing. It has a variety of causes. Some, like Alzheimer's, are permanent, but others, like nutrient deficiencies or medication side effects, might be fixable with the right care. Understanding the cause is the first step to getting the right help. If you or a loved one shows signs of dementia, talk to a doctor. Early action makes a big difference. What are the symptoms of dementia in older adults? Let's talk about the symptoms of dementia. And here's the thing, it doesn't look the same for everyone. Dementia usually progresses in stages, and the signs you see will depend on how far along the condition is. It's like a journey that starts with small changes and gradually gets more serious. 1. Early stage symptoms. In the beginning, the signs can be so subtle that they're easy to miss. You might even brush them off as just getting older. Here's what to watch for. Forgetfulness. Things like losing your keys or forgetting appointments happen more often. Disorientation. Feeling lost even in familiar places or losing track of time and dates. Difficulty concentrating. Tasks that used to feel easy, like paying bills or following a recipe, start to feel overwhelming. It's easy to chalk these up to being tired or distracted, but if they keep happening, it's worth paying attention. 2. Middle stage symptoms. As dementia progresses, the symptoms become harder to ignore and can really affect daily life. Memory loss gets worse, forgetting the names of close friends or recent conversations. Communication problems. Finding the right words or following a conversation becomes a struggle. Getting lost, even at home, someone might feel confused about where they are. Repetitive behavior, asking the same question over and over again without realizing it. Needing help. Everyday activities like bathing, dressing, or cooking require assistance. This stage can be frustrating for both the person with dementia and their loved ones. 3. Late stage symptoms. In the late stages, dementia becomes severely debilitating and the person often relies completely on caregivers. Here's what happens. Severe memory loss. Recognizing family members or friends becomes difficult. Loss of independence. They can no longer handle basic tasks like eating or moving around. Physical challenges. Walking or even sitting up can become difficult. Behavioral changes. Agitation, aggression, depression, or paranoia may become more frequent. Increased vulnerability. The risk of infections and other health complications rises significantly. Why recognizing symptoms early matters. The earlier you spot these signs, the sooner you can seek help. Early intervention won't cure dementia, but it can slow its progression, making life easier for everyone involved. So, if you notice any of these symptoms in yourself or someone you care about, don't wait. Reach out to a doctor for guidance. Potential complications. It's not just about forgetting things. This condition can lead to some serious challenges if it's not managed well. Here's what might happen. 1. Malnutrition and weakness. People with dementia sometimes lose interest in eating or even forget how to chew and swallow properly. This can lead to poor nutrition, making them weaker and worsening their overall condition. 2. Pneumonia. Swallowing difficulties are common in dementia. When food or drinks accidentally go into the lungs instead of the stomach, it can cause choking or even serious infections like pneumonia. 3. Loss of independence. As dementia gets worse, things like getting dressed, bathing, or taking medications on time become impossible without help. The person with dementia becomes increasingly reliant on family or caregivers. 4. Safety risks. Everyday activities like cooking, walking alone, or driving can become dangerous. Someone with dementia might leave the stove on, wander off, or forget basic safety rules, putting themselves in harm's way. 5. Behavioral challenges. Dementia can cause emotional and psychological changes. Agitation, aggression, depression, or paranoia are common, which can make caregiving much more difficult. 6. Risk of infections. As the body becomes weaker, infections like urinary tract infections or skin infections become more likely. Without proper care, these can escalate quickly and become life-threatening. 7. Risk of death. In the late stages, complications like severe malnutrition, respiratory problems, or infections can become fatal. Sadly, this is a reality for many people with advanced dementia. How is dementia in older adults treated? Let's talk about treatment for dementia. Now, here's the thing. There isn't a cure for dementia yet, but that doesn't mean there's nothing you can do. Treatment focuses on managing symptoms, slowing the progression, and improving quality of life. It's all about finding ways to help the person with dementia live as well as possible. 1. Medications. Slowing the progression. As death informs, there are drugs available, like cholinesterase inhibitors, such as donepezil or rivastigmine, that can help slow memory loss and improve focus. They won't stop the disease, but they can help keep symptoms at bay for a while. Managing symptoms, medications can also be used to treat things like anxiety, depression, or aggression that often come with dementia. 2. Lifestyle changes. Healthy diet. Eating a balanced diet rich in fruits, vegetables, and omega-3s can support brain health. Regular exercise. Physical activity improves blood flow to the brain and helps with overall well-being. Mental stimulation. Activities like puzzles, reading, or learning something new can keep the brain active and engaged. 3. Structured routines. Dementia thrives on confusion, so creating a predictable daily routine can help reduce stress. Things like setting regular meal times, sticking to a schedule, and using reminders can make life easier for everyone involved. 4. Caregiver support. Let's not forget about the caregivers. They play a huge role in managing dementia. Providing assistance, caregivers help with daily tasks like bathing, dressing, or eating as dementia progresses. Emotional support. A calm, understanding approach can make a world of difference for someone with dementia. Getting help, caregivers should seek support in utero, whether it's from family, professional services, or caregivers support groups. 5. Creating a safe environment. As dementia progresses, safety becomes a concern. Home adjustments. Things like removing tripping hazards, installing grab bars, or using GPS trackers can help prevent accidents. Supervision. For people prone to wandering or confusion, having someone nearby is essential. 6. Therapy and activities. Music therapy. Listening to familiar songs can spark joy and improve mood. Art and crafts, creative activities can help maintain motor skills and provide emotional expression. Reminiscence therapy, talking about old memories and looking at photos, can create a sense of comfort and familiarity. 7. Early intervention is key. The earlier dementia is diagnosed, the better the chances of managing symptoms effectively. If you notice memory problems or confusion in yourself or someone you care about, don't wait. Talk to a doctor. There are options to make life easier, even with dementia. Dementia in older adults is a complex condition that significantly impacts quality of life. Understanding its causes, recognizing symptoms early, and adopting effective treatment and care strategies can improve outcomes for patients and their families. Thank you so much for watching this video and learning more about dementia in older adults. I hope the content was helpful and provided you with valuable insights. If you found this video useful, please hit the subscribe button so you don't miss out on more meaningful content in the future. Don't forget to like the video and share it with anyone who might benefit from this information. Your support means the world to us and motivates us to continue bringing helpful and educational content.